What's good, Hoopers? My name is Marco Lopez. I'm a doctor of physical therapy and co-founder of the Basketball Doctors. Our goal for the Basketball Doctors is to provide you guys the most latest up-to-date evidence-based information regarding rehab, performance, and injury prevention of basketball. So this is all just educational information, not medical advice. If you're dealing with an injury, reach out to us or contact your local physician or physical therapist. So for today's topic, we're going to go over how to decrease your risk for ACLs in regards to deceleration. So before we go into more about ACL injuries, let's give you guys a quick breakdown of what the ACL is. And here's a video that goes into all things ACL, just a 101. You got to check this video out. But I'll give you guys a quick intro. The ACL goes from the back of the top part here, the femur, to the tibia, and it provides that stability in the knee. So that's why you've probably seen, the ACL has a bad rep because all you hear about is it getting torn. But the ACL provides a huge role in stability in the knee. And most of these injuries occur two ways, contact and non-contact. Contact occurs when someone hits you and your foot's planted here, and then that causes that ACL tear. Non-contact is your knee gives out, and 70% of those are non-contact ACL tears, and we could decrease the risk by working on your movement qualities. One of the things that we really work on is deceleration. If you notice, a lot of ACL tears occur when you're stopping or decelerating. So that means you're running and you stop, and when you stop with your knee slightly bent, not bent all the way, and your body's kind of turned inward, and that's what causes that ACL tear. Or whenever you're stopping to change direction, that's what you've seen in the football players. They try to stop and their knee just gives out, they fall down on the ground. That's that ACL tear. And the way we could help decrease the risk for that is by working and improving the movement mechanics of that cut or that deceleration. So in today's video, we're going to go over how to improve your deceleration in just here, the sagittal plane. So we're just going to work on what we look for when we're going forward and stopping. And it's a good way to really test out, are you at risk, and also how to decrease your risk in a way that's safe and also improve the way you move. All right, guys, we're gonna go over that deceleration component, really working on our movement mechanics and the quality of the movement. So when we talk about deceleration and ACL injury, we're trying to limit that knee valgus. So we're trying to really work on that stability of the knee. So whenever I do a deceleration thing, I'll show you guys the way that some people commonly do it, and that's what causes some of the ACL injuries. So when we decelerate and pause, that's a deceleration, and that's gonna allow us to change direction, change movement, and jump up. But the biggest thing we're looking at is when people do that, we want to make sure their knee's not coming in. So a little drill we like to use with our athletes is we'll have them run to a little pre-selected cone and stop there. So I'm going to run and stop there. When I stop in this position, I'll show you guys here, this is a pausing position. I'm going to want to see in the athlete different things. So one of them is that pelvic stability, meaning am I dropping in my pelvis? Is my pelvis stable? So my knee could be straight, but my pelvis could be dropped, and that's gonna create relatively internal rotation here. So when I go for that stop, I wanna make sure the first checklist is if this is leveled, because if it's not leveled and it's dropping, or it's like this, even though my knee is straight, that's not providing that knee stability. So that's the first thing, that pelvic stability. Another thing besides the knee that we have to look at is our trunk stability. So when I decelerate, my trunk should be stable. And we have a video about core exercises and everything. But if my trunk is not stable and I go like this, that's gonna create relatively internal rotation of the femur, and that's gonna put more valgus force in that knee, because what happens is if I decelerate and I go this way, my body mass right now is putting that indirection force here, causing that ACL injury. So what I'm gonna look for is when I stop, my trunk is relatively stable. I'm not leaning one side or the other side. That's checklist number 2. So the first one is pelvic stability. The next one is trunk stability. Now we're looking at the knee stability. So as we stop, this is where we're talking about the knee, is does the knee come in or go out too much to the side? We want it to be around that second and third toe in that little area. So when I stop, I want to stop and my knees are following my second and third toe. What I don't want is my knees stop and then it goes here uncontrollably. I'm okay with me stopping and then it goes out a little bit, but then I recorrect it. So I'm controlling that, correcting that position. What we don't want is the knee stopping and the knee goes too much to the inside uncontrollably. So that's checklist number 3 in just viewing it straightforward. So when we're coaching an athlete, we're looking, if he stops here, is his trunk stable or is it moving side to side? Is his pelvis stable or is it dropping? Is his knee stable or is it moving inward outward? If we look at side views, if I stop here, we're also looking at different hip or knee strategy. Sometimes we see athletes stop and they stop like this. Their knees way past their toes and their trunks upright. That's more of a knee strategy. Another one is too much of a hip strategy. They'll stop, their knee doesn't bend too much and they bend too much at the hip. We want a combination of both, meaning when we stop, we want to have a good angle of our hip and our knee. Too much of a knee strategy is going to cause injury. Too much of a hip strategy is going to cause injury as well. Because when we stop, we also want our knee to bend, because when we bend our knee, it protects the ACL because we have the quad and the hamstring co-activating, preventing that increased traction of the ACL. But if we bend too much of the knee, we're going to put ourselves at risk for different issues because now we're using too much of our quads, not our glutes. So we want to have that equal strategy when we stop. That's why when we stop, you're going to see my chest almost past my knee, the decelerator, that I can use my hips and my quads. So those are the checklists that we're looking for. So trunk, pelvic, knee, and also seeing the side view. Hopefully you guys learned a lot from today's video on how to decrease your risk for ACLs when you're decelerating. So as I mentioned, there's 70% of all ACL injuries are non-contact. So if we could help decrease the risk for those ACL injuries by working on the movement qualities, that's huge. So if you guys liked our video, hit the like button, hit the subscribe button. Also check out our ACL video playlist. We have a bunch of ACL videos. And if you guys have any questions about ACLs or anything, comment below or send us a message. But we are the Basketball Doctors. Let's ball for life.